So we're going to talk a little bit about diabetic neuropathy today. We see a lot of it. We have a number of patients who come in. I think to frame this for those of you who are interested in this topic, I do most of the interviews of patients coming into our office. I'm Dr. Rutherford. I'm still not sure where I was supposed to tell who we are or not. I think it's on the bottom line there, but I am a certified functional medicine practitioner as well as a chiropractor. Dr. Gates is a board certified chiropractic neurologist who practices functional neurology. And together we work with the brain and the nervous system and the metabolism to address chronic problems. Our practice developed into a chronic pain practice on its own. And one of the things we see a lot is diabetic patients, because there's a lot of diabetic people running around out in the country right now. Mostly diabetes type 2, some diabetes type 1s we see. But the big thing, the most common conversation I have with the patient is, well, I've got this problem and they've told me, we're peripheral neuropathy, right? Mm-hmm. They've told me that my peripheral neuropathy is probably from diabetes. I went to the doctor told me that I'm not diabetic, and so that couldn't be what's causing my peripheral neuropathy, or I am diabetic, and 50% of peripheral neuropathy is diabetes, and 50% of it we don't know what it is. Some doctors will say, okay, you've been treated for the diabetes, it's not working, you got to live with it. Some will say, okay, you've been treated for the diabetes, it's not working, go check your neck and your low back and your ankles. And once you're done with those 4 scenarios, I think it was 4, then you pretty much end up in our office or some office similar, telling me that, well, it's not my diabetes, the doctor told me it couldn't be my diabetes, and yet you're sitting there screaming diabetes relative to your history and your burning feet and so on and so forth. So we thought we'd spend a few minutes and kind of tease that little Rubik cube out for you and relative to diabetes mm-hmm. and peripheral neuropathy. I'm going to defer to Dr. Gates on this. Dr. Gates does the vast majority of the treatment here with this subject, and it's a bit of a complex subject, and I'm going to turn it over to him. I probably interrupt them like I usually do along the way.
So a large percentage of diabetics will develop peripheral neuropathy. The estimates are from the Rochester diabetic study conducted by Dr. Dick, who is the world's foremost researcher on peripheral neuropathy.
I prefer to pronounce it Dyke. But either way.
I may be pronouncing it incorrectly, but
D-Y-K-E?
D-Y-C-K.
D-Y-C-K. Okay.
And he showed that upwards of 66% of type 1 diabetics, insulin dependent, have peripheral neuropathy, and 59% of type 2 diabetics have peripheral neuropathy. Now, under that heading, know that some of those cases are due to things like carpal tunnel syndrome and other neurologic peripheral nerve disorders separate from what is commonly termed peripheral neuropathy. See, peripheral neuropathy in the lay language is like sciatica. Peripheral neuropathy really means what is commonly termed a polyneuropathy, where you start to lose sensation in your feet and it can spread up like socks up to your knees and then hit the hands. Now, with diabetic peripheral neuropathy, it's an insidious process. So lots of times it comes on over a period of years, and as Dr. Rutherford alluded to, if you try to correct the blood sugar once the peripheral neuropathy has started, lots of times there's so much nerve damage at that point that the person is not going to feel better by really getting their blood sugar under tight control. However, studies have been done that have shown that if you really control the blood sugar very tightly with diabetes, that in essence, peripheral neuropathy will be much later to onset if it's going to, or it may not onset at all. What's unique about our program is that we look at correcting not only the metabolic side of the equation, but also rehabbing the nerves. Now, let's back up. So we're writing a book on peripheral neuropathy, and it's termed Peripheral Neuropathy Success Stories. And I'm going to tangent again into another book we just read about Lyme's disease. And that author, Dr. Horowitz, just did a fantastic job talking about what the Lyme's disease patient is up against in terms of they're going to go to their
infectious... If you have Lyme, you need to read this book.
Yeah. And they're going to go to their infectious disease specialist, and they're going to be told, oh, well, you're on antibiotics for 30 days, you're not better, we don't know what the cause is, you're crazy, go home. Many neuropathy patients are told, you have neuropathy, go home and live with it. There's nothing that can be done for you. Really, the more accurate statement is that there's nothing in the medical model right now that can be done for you. There's no insurance reimbursement program basically for your doctors to put you through a rehabilitative program, coupling that with metabolic treatments to get you better. It just doesn't really exist. Just like there isn't a 6-month Lyme disease program that's really sanctioned by many insurance companies. So the average neurologist out there is going to tell the diabetic peripheral neuropathy patient, there's nothing that can be done. Take some gabapentin if you have some burning pain, as an example. We're not telling you to do that. And basically, that's going to help alleviate your symptoms to a minor degree and deal with it. Now, our approach is unique in that we look at trying to really correct the underlying metabolic cause. In this case, it's diabetes, obviously. And we know with diabetes that when someone's diabetic, it attracts water, in essence, into 3 tissues of the body: the retina, in your eye, your kidney, and nerves. And in doing so, that can cause the peripheral neuropathy. Now, there are also studies that have been done that have shown that the nerves can be regenerated, stimulated to change someone's sensation. Largely, that's done through electrical stimulation. The problem is when they've done it with diabetics, the results are short-lived. They last a couple days, and then the person goes back to their feet feeling numb or tingling or burning or whatever. And so our emphasis is on controlling blood sugar as tightly as humanly possible. Now, you're probably saying, well, you know, my blood sugar is sitting at 150 and my A1C is at 7.2, and I'm taking 4 blood sugar medications. Okay. I will come back to that point. Go ahead.
Yeah, go back to what you said about the electrical stimulation.
What about it?
Okay, so you were saying that the problem with that is that you're not handling the other things and it's short-lived.
Right.
The thing I run into was patients will say, my doctor told me that you can't do the stimulation. And the stimulation is short-lived, but it's short-lived because the study didn't do all of the things that you're about to talk to. So you can use those stimulations, but if you use those stimulations, there's some things online that'll tell you to use these stimulators, and you will get some temporary relief. But unless you start doing everything that Dr. Gates is talking about in the functional model, you're not going to get any long-term relief.
Right.
So the combination of those two is where Dr. Gates is going. It's a very successful model.
Right, and that is a perfect point. And I've scoured the literature. If you can find something different for me, please bring it to our attention on powerhealthtalk.com. But basically, the studies have been, okay, how tightly can we control a diabetic's blood sugar? And that's where I talked about. In those studies, they found that peripheral neuropathy is later to onset in those studies. And they've done the studies where let's stimulate the nerves of the diabetic. And we see that the diabetic commonly with peripheral neuropathy will have more sensation in their feet. Their balance may improve, things of that nature. But again, the results are short-lived, and that's why your medical doctor is telling you that nothing can be done. What we've done is that we're melding the two disciplines there. We're really trying to control the person's blood sugar tightly, largely through dietary interventions and other techniques of manipulating the gastrointestinal tract. You're probably saying, what? Go back and watch our hangout on powerhealthtalk.com about metabolic syndrome, diabetes in the gut. It's a fantastic broadcast where we really, if I say so myself, where we talk about the relationship, the new data on bacterial populations and problems with insulin. And so with that being said, just know that we're seeing cases, and we're not saying we have the cure for everybody, but we're seeing cases where we take patients with diabetes, change their diet significantly, do things to get rid of these bad bacteria and weird bacteria in their guts, see changes in their blood sugar in a very positive direction while simultaneously stimulating their nerves. And we frequently, by the end of our treatment programs, have patients who are not diabetic. Most commonly, they're more in a pre-diabetic range. And they have far more sensation and feeling in their feet and lack of weird nerve signals in their feet as well, burning, things of that nature. So that's what we have to say about diabetes. I have a few other things, actually, but go ahead.
No, go ahead.
And, you know, you may be taking alpha-lipoic acid. Dr. Dick came out and he did a study where he gave diabetic neuropathy patients, if I remember correctly, 600 milligrams of alpha-lipoic acid 3 times a day. And he showed that basically the nerve degeneration slowed down, which is a good thing. That's something that you probably want to have happen if you have diabetic neuropathy. So there are things like that out there. There are also these things termed aldose reductase inhibitors, which in essence decrease the amount of water going into your nerves via an indirect mechanism that I can talk to you about personally if you want to. But basically, those are things that have been experimented with, but as you well know, medically, and this is not a denigration to the medical system, just know this is not a denigration to your medical doctor, your medical neurologist. They're doing everything they can to help you within the system that will allow them to help you. But know that there really is nothing medically, as you've been told, that we know of to help peripheral neuropathy, but lots of times we have patients coming to us searching for other modalities that may help them. And as we've discussed in this broadcast, it's pretty exciting. So, anything else you want to say?
Yeah, the couple of patients that come in who are they're on medication, that they're controlling their diabetes. I might want to define that a little bit better. If you're on 2 blood sugar medications and you think that you're at 116 and you're controlling your diabetes, and you still have peripheral neuropathy symptoms, you're not controlling your diabetes. And if you have to take 2 or 3 blood pressure medications, a lot of the things that Dr. Gates was just talking about and much more are involved. A lot of times you're going to find that you'll have this small intestinal bacterial overgrowth that he talks about, and you don't even have to have symptoms of it. You can have it. You might have a thyroid problem that's been undiagnosed. So if you're taking a couple of 2 or 3 medications and you're tightly controlling your blood sugar, you're not tightly controlling your blood sugar. If you're taking 2 or 3 medications and you are tightly controlling your blood sugar and it's in the 90s and you still have peripheral neuropathy, you are still having other problems, and those other problems are what's causing you from not having a resolution of the burning in your feet and the sensations that Dr. Gates talked about. And then there's also patients that come in here who have brought their blood sugar down with diet and exercise and still have peripheral neuropathy. And I think the point that Dr. Gates made, and I just want to clarify it, is you can get, your nerves are starting to die down there. Essentially, in English, your nerves are starting to die. But they can be, as Dr. Gates uses the example to the patients, you can bring those nerves back, kind of like
strengthening a weak muscle,
kind of like strengthening a weak muscle, or do you still like the defibrillation thing?
Shock them back into life.
Shock them back to life. And so, but you can only shock them back to life, and it's a 2, but as he stated, it's a combination of the 2. You can shock them back to life, but if you're not getting, but if there's other things that are there in addition to your blood sugar that are perpetuating that, then it's gonna still be there. We have a very, I can't speak for all functional medicine and all functional neurology, but we do have a pretty tight program relative to screening patients for that. Just purely on its own, our practice has developed into chronic pain practice, and a significant percentage of it is peripheral neuropathy. So we're speaking from experience here, and a lot of trial and error, and a lot of sleepless nights figuring this out. And when Dr. Gates says that our results are pretty significant, they're pretty significant. So what we're saying is, we're talking from that experience and experimentation that this is what you need to look at. You need to go way beyond the stimulation doesn't work and it's temporary, and way beyond I got to tightly control my blood sugar, and if I control it and it's still there, I got to live with it.
Exactly. And one last thing I'll close on is you also have to look for other confounding variables relative to your peripheral neuropathy. Like we know that metformin, medication commonly used to treat diabetes, can cause B12 deficiencies, which is associated with peripheral neuropathy. And lots of times we find our diabetics may have problems with certain foods. It goes on and on. They may have thyroid disorders. So we have many more talks on peripheral neuropathy and other topics, as I alluded to. You definitely should watch the broadcast on metabolic syndrome, diabetes in the gut.
It's a pretty comprehensive broadcast on this topic.
And it's on powerhealthtalk.com. You can also send us questions there, as well as to our Power Health Facebook page. So thank you for watching. Have a good day.